Good afternoon and welcome to our daily media briefing. Hope everybody in San Diego had a great time over the weekend, beautiful weather, and we're getting the chance to get out and enjoy that weather along with a lot of other activities. From all the reports I've heard, San Diego really responded very well this weekend and did so in a very orderly manner. We're glad to hear that. That's really good because as we enter this first full week in May, we're at a very delicate balancing point and turning point. Over the last week, we've seen downward trends in some of the important metrics we've been monitoring on this disease, and as a result, we've been able to ease up on some of the restrictions. We've allowed beach areas to have access so that people can swim, surf, or walk along the beach. We've allowed golfers to enjoy the links again as another avenue for getting exercise and getting outside and getting some fresh air. And we've allowed families to enjoy parks more. We've allowed recreational boating, certainly with certain limits. These are all very small, but let me tell you, they're very important steps that will give us a breather and let us enjoy life a little bit more as we see some of these other restrictions lightened up over the course of this next week. But we're only able to take these steps because of the hard work and effort of all San Diegans to continue social distancing, continuing wearing facial coverings, and continuing to avoid large crowds. The importance of wearing a facial covering was highlighted in a story called "The Real Reason to Wear a Mask" in the Atlantic magazine. He said to think of the coronavirus and the pandemic as a fire that is spread by infected people breathing out invisible embers every time they speak, cough, or sneeze. Sneezing is the most dangerous. It spreads embers furthest, coughing second, and speaking last, though it still can spread the embers. These invisible sparks cause others to catch fire, and in turn breathe out embers until we truly catch fire and get sick. Facial coverings help people keep embers from being sent out every time we speak or cough so that people won't catch fire or get sick. And because we don't know for sure who's sick, the only solution is for everyone to wear a facial covering. I can't emphasize enough that until there is a vaccine, the battle against COVID-19 will be won by all of us taking individual actions. Those small but vital actions will amount to a collective assault against the spread of the virus. As you may have heard, today the governor announced that some retail stores will be able to open as early as Friday as the state moves into the next phase of its recovery. That is truly great news. And we'll hear more about that in detail from Supervisor Fletcher in just a couple of moments. Tomorrow, Supervisor Fletcher and I will bring to the Board of Supervisors a framework for businesses to work from as we prepare for a gradual reopening in our region. We know it won't be business as usual, so this framework will ensure all of our local businesses and industries are prepared. You'll hear more about that this afternoon when I join Mayor Faulkner at his press conference at 4:30. Excuse me. Together, all these actions will be pulling us further from the edge, but we are not out of the danger zone, so we've got to continue and be smart and disciplined. So thank you, San Diego, for hanging in there and doing the things that we've been asking you to do. This weekend, I think we really had very minimal disruptions, and so we thank you for your concurrence and abiding by the different directives. So with that, let's move on to today's briefing, and I'll call up Supervisor Fletcher.
Thank you, and good afternoon. April was a month of action in San Diego County, and as a community, we came together. We took significant action, which significantly flattened the curve. We also bought ourselves time to be able to build up surge capacity in our healthcare system, begin to see progress on testing and tracing, and lay the foundation for what lays ahead. We talk about May as being a month of adapting our way of life as we begin to loosen, as we begin to see movement and changes. That as we go back out into some of these environments that we're doing them in a different way than we did them before. The adapting are things around face coverings, around ensuring physical distancing, around continuing hand washing, around seeing how we can adapt our daily way of life in a way that doesn't provide tremendous community spread and doesn't put us back in a situation of having the integrity of our healthcare system overwhelmed. The governor today outlined some initial steps that he believes the state of California can take on Friday. That is incredibly good news, both for those businesses that are looking forward to moving forward, but also for the entire state of California that has flattened the curve significantly, certainly compared to other states. The governor's action was based on the science and the data, and that is the way to do it. Here at the County of San Diego, we will do the same. Given the present state of where we are and the way things are trending, we expect to be able to join in the state of California's loosening around retail, logistics, and manufacturing restrictions on Friday. That is a positive step forward for our region, but it is one we have to be mindful that we have to be very cautious, that we still have to exercise tremendous restraint, exercise tremendous responsibility, and take that same level of commitment we took in the month of April around actions to ensure we stay home, and put that same commitment and that same focus around adapting our daily behaviors as we begin to ease out of these restrictions. As Supervisor Cox mentioned, tomorrow at our board meeting, our colleagues will hear a proposal from Supervisor Cox and myself around the framework, the safety plan, the guidance for businesses as we begin to reopen. This is something that will see continued input, continued adaptation, continued change, but we think it is an important step forward in moving into this new era that we are going to find ourselves in. And we will continue to work closely with the state. The governor also outlined county's possible ability to move a little more swiftly into stage 2 based on completion, certification, and adoption of a readiness plan. And we look forward to getting continued guidance from what would be in that readiness plan, along with assessing our progress as a region to see how far we can go responsibly. While today is good news for the state of California and it is encouraging news for us here in San Diego County, we have to all keep in mind that we haven't crossed a finish line. This is very much a race that we continue to run. It is a condition that we continue to treat. It is something that we continue to monitor daily. Instead of viewing our position now as the beginning of the end, it is more the end of the beginning. And as we move forward, we will have to continue to not only monitor our progress, monitor our surge capacity, monitor our healthcare system, monitor our testing and tracing, but also continue to monitor our daily activities and actions. This is why, as we see loosenings in some things, we see tightening in others. Things around face coverings, as Supervisor Cox talked about, it's why these things are so important, because we are moving forward now, and that is a good thing, but we want to continue to move forward. We don't want to see outbreaks. We don't want to see tremendous spread that put us in a position of having to go backwards. And so we ask for the public's continued help and cooperation and understanding that as we begin to move forward, we must do so carefully, thoughtfully, methodically, but we must also do so with a great sense of commitment to continuing to protect one another. We will not truly be out of the woods as it relates to coronavirus until we have a vaccine or a therapeutic treatment, and that is a timeline that there is no way to predict when it will happen. The governor did talk quite a bit today about testing and tracing, this being a cornerstone of our daily efforts as we begin to move forward. We've certainly spent a lot of energy and effort around that here at the county, and those efforts continue. I want to share with you that we're going to have a new testing option for San Diego County residents. We are working in partnership with the state of California, and there will be 3 new testing locations that will be opening tomorrow, Tuesday, May 5th. We believe that these have the potential to do about 800 tests per day. Individuals will drive up, likely have to get out of their car, and will have a test performed. Unlike other testing, you do not need a referral from a doctor, but you do need to make an appointment. And in a moment, I will share a slide that has the website you can go to. Any San Diegan can go to this website, answer a few basic questions, insert your information, and then try to schedule an appointment. The 3 initial locations we have will be at Grossmont College in El Cajon, the county's North Inland Live Well Center in Escondido, and the former Sears building in Chula Vista. We expect, even though this is scheduled to start tomorrow, that although this is a new operation, it is a new personnel, it is something new, we expect there to be some hiccups, some bumps in the road as it gets sorted out, and so we ask for everyone's patience. This is a daily resource that we think will be present daily for the foreseeable future, but it may take a few days to truly get everything ironed out and see it up and running. But we'll share the website with you where any San Diegan can go and make an appointment. And for those who don't have access to the internet, in a minute we'll share an 800 number where folks can call and make an appointment as well. Before we get to that, no significant update on the homeless testing. There was no testing done over the weekend. So the number of tests still administered at the convention center is 1,124. That is 3 positive residents, the same as was shared on Friday. The rest are negative, indeterminate, or a few that are still pending results. So we will continue to monitor that. Now we'll jump into our charts. The first one is our T3 strategy. This is our efforts around test, trace, and treat. You can see today we're reporting 1,293 tests. This is down from the last few days, but it is not uncommon on Mondays to have a dip in total tests being reported, a lag from the weekend. But again, we're striving towards that daily goal of an average of 5,200 tests as an initial goal. Total tests is 61,171. Slight uptick in our tracers from where we were last week to 135. Again, we have an initial goal. This is just a goal of 450. Based on some of the estimates coming out of the state of what they believe they need statewide, we expect that this goal will increase, but it serves as an organizing principle and something that guides us towards where we want to go. And we now have performed 4,903 investigations. And then on the treatment, these are individuals in isolation who've received help at our public health motel rooms. There are presently 180 individuals receiving care in isolation there for a cumulative of 552 total. Next is the slide on the website for the testing program that is being launched effective tomorrow. You can go to this website, lhi.care/COVID testing, answer the questions, your name, some basic information about your health coverage status, choose a testing location most convenient for you, and attempt to make an appointment. And again, it's a little bit of a clunky website as you go through it. It takes a little bit of patience and commitment to see through, but it does work. It's not necessarily the easiest one, but again, we're just getting it up and running, and we think that it will become easier and smoother as we move forward. You don't need a doctor's referral, but you do need an appointment. And if you would rather call on the phone, you can call 888-634-1123. Again, have a little patience with that phone line as this is a new operation, a new program that is just getting up and running. Today on our daily reports, we're reporting 93 new positive cases. This is out of the lower testing I mentioned, 1,293 for a percentage positive, percentage of 7%, a little bit above our 14-day rolling average, but not significantly out of line, but you can see that for today. ICUs are at 145, you can see in the hospitalization chart. And you can see for a total of 353 with holding relatively flat across that line. And then next we'll look at that in the context of the entire health system capacity. The orange numbers representing COVID-related patients in both regular hospital and ICU. The blue representing those current beds in use. We do expect as we move forward into the coming weeks to see that blue line begin to increase. We saw a significant decrease in individuals going to the hospital when things they normally would have gone. We expect people to begin going back to the hospital a little bit closer to what is normal and average. And as some hospitals begin to make decisions to expand some procedures they're doing, we do expect the blue line to increase a little bit. What we're primarily concerned about is the difference between the total number of hospitalizations, COVID and non-COVID, and the current available bed capacity. And that is what we watch and monitor. On the next chart, you can see the positives, which we've talked about there, cumulative positives. The estimated number of recoveries, 2,182, along with the doubling rate for hospitalizations at 32, holding generally steady, and the doubling rate of ICUs at 25, and then the unfortunate loss of life you see represented on that chart there. With that, I will turn it over to Dr. Wilma Wooten for her Public Health Officer's report. Thank you.
Thank you, Supervisor Fletcher, and good afternoon, everyone. The statistics for COVID-19 continue to increase worldwide. Regarding the global, national, and state statistics, based on data from the Johns Hopkins database that was obtained today around noon. Globally, there have been over 3.5 million positive cases, including almost 250,000 deaths. The United States is reporting almost 1.2 million positive cases, including 68,000 deaths. Statewide, almost 55,000 positive cases have been reported, including 2,217 deaths. Today, for the County of San Diego, we are reporting now 4,020 cases, which is 93 more cases than yesterday, as well as 144 deaths, which is 5 more than reported yesterday. Of the total number of cases, the age range does not change from 3 months of age to 100 years of age. The percentage of individuals 20 to 49 years of age remains at 51%, and the gender distribution also remains at 49% for females and 51% for males. 842 of the total number of cases, or 21% of cases, have been hospitalized. And of the total number of hospitalized cases, this includes 271, or 32% of the hospitalized cases in the ICU. Lastly, the 144 deaths represent approximately 4% of the total number of cases. Of the 5 additional deaths being reported today, these include 3 females in their late 70s and early to late 80s, as well as 2 males, 1 in their early 60s and 1 in their early 80s. Also, of the 144 deaths, 44% are female, 56% are male. And regarding race and ethnicity of the deaths, we have data for 94% of the 144 total, which means we do not have race and ethnicity for 9 of the 144. Of this total, 67 or 50% are white, 51 or 38% are Latino or Hispanic, 10 or 7% are Asian, 4 or 3% are Black or African American, and there's 1 each, representing 1% for American Indians, 1% for Pacific Islanders, and 1% in individual of multiple races. So our sincerest sympathies and condolences once again goes out to the family members and the friends of the individuals announced today who have died. As a reminder, all of our demographic information are on our county's website at the sign that's posted here. And we also want to provide you a report on outbreaks in congregate and community settings. Today, we are reporting a cumulative total of 56 confirmed active outbreaks. We have not had any new outbreaks reported since yesterday. Of these active outbreaks, 37 are in congregate facilities, which includes 927 cases and 72 deaths, and 19 active outbreaks in community setting locations, which includes 164 cases and 5 deaths. The county continues to applaud our public for staying the course and adhering to the stay-at-home order. Our collective efforts have really helped to decrease the spread of COVID-19, and we are look forward to additional announcements that will be made at the end of the week. As a closing reminder, as of the last Friday, facial covering is now required for all individuals 2 years of age and older when in public. So if you leave your place, remember to cover your face. Now please welcome back to the podium Chairman Cox.
Thank you, Dr. Wooten. We'll go directly to the phone calls. Again, if we don't identify you by name and outlet when we introduce you, please do so before you ask your question.
Matt Hoffman with KPBS. Please state your question.
I know earlier you got Supervisor Fletcher, you talked about you and Supervisor Cox bringing a proposal to reopen some of those retail businesses by Friday. Can you talk about what that proposal is? Because I know the governor said that he kind of left some local control where you guys could adopt some of those regulations, scale up some of those restrictions, or scale back. Just what does that proposal entail?
Well, let me start off, and then I know Supervisor Fletcher has some additional comments. What we wanted to do was to provide just basically a framework for the businesses in San Diego County that have been so patient waiting to get back opened up. It's very general in what it includes, and we are working hand in hand with Mayor Faulkner and my task force that was created about 2.5 weeks ago, the Recover Task Force. They've had 4 meetings. They're going to have 4 more meetings scheduled between now and May 15th. And as they come back with their recommendations, these are going to be guidelines that we will take a look at and try to incorporate into the overall economic recovery for those different sectors of businesses. It's going to be different for restaurants, and it'll be for retail stores, and it'll be for manufacturing facilities. So if the Board of Supervisors goes along with what we're recommending tomorrow, we'll have a framework, which will obviously be somewhat massaged based on what the governor comes out with on Friday. And those will be incorporated into future public health directives. And I know Supervisor Fletcher wants to say some additional words.
Yeah, Matt, just to be clear, what we're voting on tomorrow is basically a general framework that would apply to all businesses as they open. It would apply to essential businesses who are open now. It would apply to new businesses as the state of California provides some flexibility, but it would be the same framework that would apply across the board. Obviously, there will be some unique characteristics around unique industries, but what we're trying to do is set a regional standard to let businesses know the types of things that they need to prepare for, the types of things they need to think about, the types of things they need to do for opening. The timing of which businesses are allowed to open at what point will be a decision in some way guided by the state and in some way guided flexibility from the state. So what the governor talked about today was perhaps as early as Friday, counties being able to move into the initial part of the state of California Stage 2 with opening up some retail, and he outlined things like bookstores and sporting stores and different types of things like that where they have a curbside capacity. And the corresponding logistics and manufacturing that go with those same industries and entities. He also alluded to the possibility of counties being able to make a decision to move a little further than that based on preparing a readiness plan. We expect to get the guidance on what goes into that, the parameters around what they would like to see, along with what are those additional sectors that they could do. And so I think it's going to be a mix of the state of California taking a whole step, and then counties having some discretion about perhaps going a little farther, or in the case of some counties, they may go a little bit slower. What we want to do throughout this process, though, is try to have one consistent standard so every business knows what is expected of them. And that is something that is likely to evolve, but our hope is tomorrow we can pass something as a Board of Supervisors, put the framework out there, and let businesses know what to expect when their time comes to reopen.
Just to follow up, is there a chance that those businesses could be open by Friday? Or just to kind of simplify what you said, I know the headline coming out of what the governor's saying is that some of these businesses will be able to reopen by Friday. Is that going to be the case here in San Diego County, even if it passed tomorrow at the board meeting? Or are you guys foreseeing this moving past the end of the business week?
Well, we expect, based on where we are now, in terms of our overall progress in tackling coronavirus, that we would be able to move consistent with the state on Friday. But I think it's important to note that the governor's initial Stage 2 is very limited. It's a limited number of retail just for curbside only. Now, we'll have to continue to assess, and ultimately that is the call of our public health officer and Dr. Wooten. But it is certainly the expectation that we would be able to move with that first step with the state of California as early as Friday by the end of the week.
Gotcha. And then just one other one. I know that in the last week or so, cases here have gone up by about 1,000, deaths by about 30 people. Can you put that into context for us? I know we're seeing the much higher numbers coming out of LA County, much lower numbers coming out of Orange County. What is that telling us on a week-to-week basis here?
Well, it's really important as we see an increase in testing that we not be driven by the number of positives. If you remember at the outset of this, we said that we thought the number of positives was an estimation of perhaps 10 times greater than what we were reporting because of limitations in testing. As testing continues to increase, we become more aware of what's already out there, but it doesn't necessarily reflect a significant increase in the spread. And so it's important to look at the percentage of positives as a better guide in terms of what's happening, but also to look at the health system capacity, because those numbers are accurate in terms of who shows up at the hospitals. And so that is an important one to look at each day, along with the one that Dr. Wooten has shared many times, which is influenza-like symptoms at our emergency rooms. And so we will have to monitor and assess all of those to continue to determine our trajectory, where we're headed, where we think we can go, when we need to pause. But at this point, with the limited thing the governor outlined for Friday, it's our expectation, barring something changing, that we would be in a position to move forward with that.
Thank you.
I might just add on that last question that the framework that we're going to be asking our colleagues to consider tomorrow covers pretty broad areas such as employee safety, customer safety, sanitation, physical distancing, and then general business practices and communications. I want to acknowledge also that this has really been kind of a team effort. We've received input from the building industry through some efforts that Supervisor Kristen Gaspar had initiated, and also by Supervisor Jim Desmond and Supervisor Diane Jacob, thank you. They've been working with the North County and East County chambers, and they've provided some input too. And again, this will be built upon as we bring it out tomorrow. We expect it to have some guidelines that will also be provided through the efforts of the Recovery Advisory Group. So we will consider it a work in progress. Let's go to the next question.
Brandon Lewis with CBS 8. Please state your question.
Yeah, wanted to ask about tracing. We heard you guys talking about the need for tracing and hiring tracers. I'm wondering if you could discuss what someone might experience if they're contacted by a tracer, and then some of the qualifications for the tracers themselves, because we're reading on the job posting that is archived that it didn't necessarily require some medical experience.
Dr. Wooten's going to respond.
Thank you for the question about contact tracing. When we conduct investigations in our epidemiology department, there are two major components. First is the case investigation, and then we interview that individual to find out who their contacts are. And the number of contacts can range anywhere from 3 up to 10 individuals. But we look first at the very close contacts, and then at any other contacts that might be associated with an individual case. Very close contacts, of course, would be household members, or if someone shared a cubicle with someone, as opposed to them having contacts that are in the office setting. So when our staff gets the case, that interview process can take several hours, and once they get the names of the contacts, then those individuals are contacted. And that can take a less period of time, but it still takes time nonetheless. So in reaching out to all of the various contacts, we are going to, given the fact, as you heard today, as we continue to have increased number of cases, we want to make sure that we are reaching out to all of the contacts, and this is one way that we are decreasing the spread of COVID-19. So having individuals to reach out to them. Being a nurse is not necessary. We use our epidemiologists and our nurses for the case investigation. Contact investigations can be, we use what we are calling communicable disease investigators. So we are interviewing and recruiting individuals that would fall in that classification. Does that answer your question or provide clarity about the contact tracing?
Yeah.
Thank you.
Yes, it does. Thank you.
Mm-hmm.
Okay, next question.
Mark Ziegler with the San Diego Union Tribune. Please state your question. There you go. Mark, I'm
Yes,
sorry. Okay.
I wanted to ask a question about golf carts once again. When you announced, I believe last Thursday, that golf carts would not be allowed, you said it was because of a part of the governor's order. However, numerous counties across the state are allowing single rider golf carts, and their reasoning is that is not part of an order from the governor, just some clarification or guidelines, and they have chosen to go ahead. I'm curious why San Diego, which is one of very few counties left in the state that are not allowing golf carts, has decided not to allow them.
Okay, I'm
And
going
will
to
you
let
revisit that?
Dr. Wooten respond.
Again, that guidance was in the governor's executive order, and we did include, however, the use of carts for individuals that had medical needs or could not ambulate. So it is included as an exception, but just the blanket order did not include carts because that was not included in the executive order, and we called to find that out, because originally we had included it in our guidance.
Okay, so just as a follow-up, just to be clear, the 8 or 10 or 15 counties that are allowing golf carts right now, including Orange County, Riverside, San Bernardino, are violating an executive order, in your opinion?
In my opinion, we are following the governor's guidance, and we clarified that, and that's what we included. As was stated, we originally did include golf carts, but we called just to make sure, to verify, and we were told that golf carts were not included. So we did not include that, but we did add the exception if someone could not ambulate or had otherwise a medical condition where it would be needed, we would allow for that.
Thank you. And one very quick follow-up on that. There are several golf courses that are not yet open. Have any of them had applications denied by the county, or is this strictly a case of them not being ready to open?
No, no, there have been no applications denied by the county.
Thank you.
Mm-hmm.
Okay, next question.
Jill Castellano with iNewsSource, please state your question.
Yes, hi. I'm following up on a story that we reported on Friday about a homeless individual staying at the Crown Plaza Motel, one of the county's isolation centers, who died by suicide on April 23rd. As a part of that story, it was reported that the county staff at the Crown Plaza are worried that they're understaffed and that they themselves might contract the coronavirus because they don't have enough protective equipment and they're being asked to interact with COVID-19 positive patients. So I'm wondering, in light of this death and the concerns raised by the staff at the Crown Plaza, is the county taking any new measures to make sure that people staying at the isolation centers are getting the mental health care they need, and to make sure that the county workers are getting the safety equipment that they need?
I think Supervisor Fletcher is going to respond.
Yeah, we continue to look into that incident along with all of our protocols and procedures, and don't have any additional comment at this time, but we'll continue to do everything we can to ensure the safety as best as possible for everyone in any of our locations.
Okay, thank you. And then just one additional question. On Friday, SEIU Local 221 announced that it had filed multiple Cal OSHA complaints against the county about dangerous working conditions, so things like overstaffed offices, leave policies that don't offer enough coverage, and not enough PPE. So I'm wondering if the county has responded to those complaints and any steps are taking to address those concerns.
Rob Sills is here. He can give you an update on the PPE. We'll have to defer comment on the specific Cal OSHA issues.
Yes, thank you. I think your first question was in regard to the public health nurses at the hotel, and we are working very closely with them to keep them stocked with the needed respirators, masks, face shields, gloves, gowns, and whatever they need. So that is ongoing, and we look at that weekly and daily if the need arises. In regards to the second question, we're doing the same thing with all the county facilities, whether it's the inpatient or our county workers. So we're in constant communication, and we're looking at what the appropriate level of PPE is needed and to ensure that they have that. Thank you.
Great, thanks very much.
Okay, next question.
Paul Sisson with the Union Tribune. Please state your question.
Hello. Hi, I had a question today about what's going on down closer to the border in South Bay, down in Baja, California. I understand that there was a meeting with the South Bay mayors last week, in which there was a presentation that indicated that May is likely to have the largest spike of viral transmissions and fatalities in Baja, and that the Baja healthcare system is facing significant challenges. In many ways, they're getting overwhelmed, and also comments that we have capacity in our hospital system to support an increase in patients. Certainly, the San Diego region hospitals have not been overwhelmed yet. Certainly, we have capacity that's waiting for patients. Certainly, we have a lot of trained medical professionals in this county. Is there anything more that you guys feel could be done to help the folks out down in Baja, whether it's sending teams down there to help out or bringing patients up here to help out? What more could we be doing to help folks across the border?
Yeah, Paul, we had a very good conference call last week with Mayor Salas and Mayor Dedina, and Mayor Sotelo Solis from National City. We had an opportunity for Wilma to kind of share the latest information we had in regards to the situation in Baja California, and I'll let her respond because I'm sure there's more recent information from the conference call we had last Wednesday.
Paul, thank you again for that question regarding what's going on the border regarding COVID-19. So as you are aware, the City of San Diego created a task force that includes involvement and reports about hospital capacity, about the fire rescue, and in terms of transports at the border, as well as customs and border protection, and what they see on the border. And just regarding that last component, many times individuals may not declare to the officers at the border why they are coming over, but individuals that are coming over are U.S. citizens that may live or spend time on both sides of the border, but they are U.S. citizens or permanent legal residents, or they are crossing because they are essential workers. So that information is being monitored. It has not crashed our healthcare system. We do have capacity, but it has to be a continual monitoring because things could change at any moment. So the activity at the border and how it impacts our healthcare system is constantly monitored through our EMS system, as well as through our Customs and Border Protection, and just looking at the impact to our hospitals in terms of ED as well as hospitalizations.
So in terms of what more we could do to help,
help
our neighbors out in Mexico, what more could we be doing? Could we get a medical mission going? What more could be done?
So in terms of sharing PPE, for instance, those supplies come from the federal government, and we cannot share that. We have brought the issue at the border to the attention of our state legislature or legislative electeds, as well as at the federal level. And then we are also engaging our nonprofit organizations locally to ask for donations that could be sent down to Mexico.
Okay, thank you.
Paul, I might just add that the International Community Foundation has a fund set up at the San Diego Foundation to assist in acquiring, through those donations, acquiring PPEs and other equipment for patients that are in Tijuana and Mexico. Let's go to the last call-in question.
Sasha Fu with KUSI, please state your question.
Yeah, I think some of it was already answered, but I was asking about the county's protocol for tracking and tracing as well. Will you be using or planning to use any Bluetooth proximity tracing? And if so, how would that system work?
Okay, Dr. Wooten's going to respond.
Thank you.
Did you hear my question?
Oh, yes, Sasha, I did. Thank you. So currently, well, there are several pieces of that in terms of training and then in terms of the actual tracking. And the governor talked today about a training process that they have in place. We have been utilizing the NACHO, the National Association of County and City Officials, training, and then other elements of trainings in terms of confidentiality and the general process. We will select elements of training from the training that the governor has identified. When it comes to IT or electronic modalities, we also will be looking at that as a way to track our contacts for contact tracing. So we don't have that system operationalized just yet, but it is part of the tools that we will be using to implement a robust contact tracing system.
Would that involve, for instance, having my phone, if I'm in proximity to a person who is infected, it would ping, and then I would be notified later that day that I've been in proximity to a person, anonymous, who is infected? Is that how that would work?
Sasha, we haven't identified the exact tool, so I can't tell you exactly how it will work at this time, but once we do land on an electronic app, then we will make sure that that is explained to everyone and everyone understands the process.
And are you hiring people at this point to form some of this, the personnel that will be needed for this?
Yes, ma'am, we absolutely are.
Thank you.
Mm-hmm.
Right, Dr. Wooten, I have a question from Claire from KPBS on contact tracing as well. California wants 10,000 contact tracers. Would the 450 the county wants to hire be separate from that number? And how long does it take to train a contact tracer? How many applications did you receive after it was posted?
We've received close to 1,000 applications. Last week, the last part of last week, we said that through our T3 strategy that we would be onboarding about 450, but if we need more, and we anticipate that we may need more, depending upon the number of individuals, contacts of an actual case, we will onboard them accordingly. And the training, I think I've just explained the training process that we're currently utilizing, and then we will also look at the training that the state has and utilize elements of that to complement what we already have in place. And there was another question?
I popped out of that text already. Let's see. What
Okay.
was it?
I think I answered it. Yeah,
Okay.
I think I've answered it. Thank you.
Okay. Sorry about that. Yeah, 450 for the county and 10,000 for...
Oh, the question was the 450 a part of the 10,000? I mean, that number is for the entire state. So we would anticipate that that would be a portion of, and that is just to get started. If, again, we have a larger number of contacts than we have calculated, then we will accordingly hire more individuals so that we can, again, have a robust contact tracing program.
And then I've got a couple of questions about the border. This first one is from Gustavo Solis from the Union Tribune. Data indicates that the first 2 weeks of May will have the largest spike in transmissions and fatalities. What specific actions is the county taking to help Tijuana's hospitals and or to prepare San Diego hospitals for an increase of patients?
So I think we've just answered that question, but I will review it once again. The information about, we also saw a statement that the first 2 weeks of May have the highest number of COVID-19 cases in Tijuana, but we really will have to wait and see what that looks like. What we do know is that they have been significantly burdened over the last 2 weeks in particular. We continue to monitor our system on the U.S. side, and the city of San Diego has convened a task force composed of Customs and Border Protection, our hospitals, as well as our fire rescue and EMS system. And those three systems are closely monitoring the impact, transports that come across the border, as well as hospitalizations. So at this point in time, while our system is impacted, it is not being overwhelmed, but we have to continuously monitor the process so that we can adjust and react and respond as needed.
And I think you just touched on the next question. They're asking about the agencies and the people who are part of the San Diego Regional Border Unified Command Team. Is that the team, the elements you just, the hospitals, the
Hospitals,
doctors?
our fire and rescue EMS system, and Customs and Border Protection, as well as the County of San Diego, and Dr. McDonald attends that meeting as well, too.
Okay, this one is also related to the border. Border cities are seeing an increasing rate of cases of 9 to 10 new cases a day. Do you know the reason for the rise of the cases of COVID-19 in those areas? And is the county doing anything in particular to work with the Mexico government on this binational pandemic?
So in answering the first part of the question, why are there so many cases? The answer, that would be the answer for why there are so many cases everywhere. If there are not non-pharmaceutical interventions, social distancing practices, stay-at-home orders in place, then we expect to see an increase in numbers. That's why we have focused on those strategies locally, with the schools being closed, with visitations limited to long-term care facilities and our hospitals. All of those interventions help to decrease spread. Also, older adults and those with a compromised immune system staying at home and not going out into public. So while we understand that so some social distancing strategies have been deployed in Mexico, we're not sure if everyone is adhering, the public is adhering to these orders. So that's why when people come together, then the disease spreads.
All right, thank you, Dr. Wooten.
These next questions really deal more with Governor Newsom's pending guidelines and reopening for businesses. So Supervisor Fletcher is going to respond to both of those questions.
All right, this question is from Bridget Naso, and it talks about phase 2, and if we have anything specific guidance-wise for people who are at higher risk for the disease, and also address childcare for those workers who may be asked to return to work during a phase 2 reopening.
Yeah, I think as we move forward into this, you're going to see continued guidance around higher risk individuals, both age and underlying health conditions. I think there will be strong encouragement for those individuals to continue to remain at home and continue to avoid contact with folks outside of their household unit. You do see a lot of conversations from what the governor outlined today around efforts to protect the vulnerable being congregate care, homeless, individuals who are incarcerated, vulnerable also being those who are most at risk. And so I think you will continue to see more guidance around that. As it relates to child care, you have child care open right now for essential workers. And so as more jobs are opened, there will be more essential workers working, and there will be a greater need for child care for those essential workers. And so I think you'll continue to see those options and opportunities expand in a safe way under the current guidance we have now.
And another related question, Channel 10. With the governor's move to try and open some of the retail outlets later this week, can you talk about how testing and tracing will guide the county's plan to open more businesses?
Well, testing and tracing is really going to be a foundational cornerstone in the adapting to the new world and adapting to the new way. And that'll be a daily effort to ensure that we have robust testing in place in order to rapidly identify every potential positive, ensure that they are isolated, and then contact trace all of their close contacts, see if those folks need to be tested, if they are positive, make sure they are isolated. And so the ability to rapidly test, to trace, to treat, the 3 T's that we're talking about, is what's going to shape our efforts as we move forward. There is a hope that through people's adaptations of their general way of life, continuing to ensure physical distancing outside of their household units, continuing to utilize a face covering when they leave their home, continuing to do sanitation and hand washing stations, things like that, combined with rapid, robust testing, tracing, and treatment, that hopefully we can contain our way through controlling the spread in a way that doesn't negatively impact our healthcare system. But that's yet to be seen. And it is possible as we move forward that we could see progress, we could see setbacks. We are all in uncharted territory here. But having that system in place really is foundational to the daily blocking and tackling of trying to limit the spread of coronavirus moving forward.
All right. Thank you, Supervisor Fletcher.
This last question deals with contact tracing, and Dr. Wooten's going to respond.
And this is from Shalina with KPBS. Will there be an effort to hire a diverse spectrum of contact tracers who will be equipped to or prepared to work in underserved parts of the county?
Thank you for that very important question. And the answer is absolutely yes. That's one of the guiding principles of the state's contact tracing program. And it is our intent to hire diverse individuals that are representative of our community. And as an additional strategy, San Diego is specifically looking at involving promotoras to be extenders to our contact tracers to really go out and help to find people or provide information to individuals, but as extenders to our core contact tracers. So that's a very important question, and we want to make sure that our program includes staff that are reflective of our community. Thank you.
That concludes our questions for today. We thank you for sending in and calling in those questions. Before we go, let me give you an update on a couple of items. And also, I always like to end up on a high note if we can. Last week, we mentioned that we had procured 10,000 facial coverings to give to our deputy sheriffs who are out in the front lines with a promise of more to come. Also, we're now getting about 5,000 of these facial coverings. And these are being made available to our parks employees. And as they go out to the parks around San Diego County, if they see someone without a facial covering, they'll be happy to give you one of these. And again, that's one more effort on the part of the County of San Diego to make sure that everybody abides by those facial coverings. Let me also highlight the good work of an organization I'm proud to have supported over the years. This weekend, the Chicano Federation of San Diego, with support from the Bank of America, arranged drive-through giveaways to provide sanitation kits to child care providers. I want to thank them for helping the community. I also want to highlight our volunteers at both the Sheriff and San Diego Police Department, who through the You Are Not Alone program are continuing to check up on homebound seniors who may be especially vulnerable during this pandemic. They normally visit these seniors, but out of precaution, the volunteers are now doing phone checks. It's great to see all San Diegans working together for one another. That's it for today. We'll be back tomorrow, but due to our regularly scheduled Board of Supervisors meeting, we're not exactly sure how long it's going to run. We might present the briefing at a different time, so please, I would ask you to check your social media feeds. Until then, remember to stay in place, maintain space, and cover your face. We'll see you tomorrow.